Hello everyone, my name is Ms. Lisha D'souza, Assistant Professor, Department of Medical Laboratory Technology, Yenepoya School of Allied Health Science. Today I am going to talk about diabetes mellitus. It's a condition where the body struggles to maintain the blood sugar level. So let's go in detail about it. So at the end of the session, students should be able to define diabetes mellitus and its types, list out signs and symptoms of diabetes mellitus, enumerate complications of diabetes mellitus, explain the diagnosis of diabetes mellitus, and explain the management of diabetes mellitus. So the definition of diabetes mellitus is, it's a metabolic disease caused either due to the insulin deficiency or failure in insulin action or both. So the beta cells of pancreas secrete the hormone insulin, which inhibits the blood sugar level. So due to various conditions in diabetes mellitus, either the insulin deficiency can be occurring or the failure of insulin action. So classifying the diabetes mellitus, we have two types, that is type 1 diabetes mellitus and type 2 diabetes mellitus. So the type 1 diabetes mellitus is called as insulin dependent diabetes mellitus, whereas the type 2 diabetes mellitus is called as non-insulin dependent diabetes mellitus. Let's go in detail about the type 1 diabetes mellitus. In type 1 diabetes mellitus, since it is called as insulin dependent diabetes mellitus, here there is insulin shortage. The onset is seen in about 14 years of age. Hence, it is also called as juvenile diabetes. So, basically this type of diabetes is seen in younger age. Here there is lack of insulin secretion, maybe due to the destruction of pancreatic beta cells. There can be various reasons where the beta cells can be destructed. It can be the viral infection, autoimmune disorder, or a hereditary tendency for beta cell degeneration. So type 2 diabetes mellitus, it's called as non-insulin diabetes mellitus, commonly seen in person above 40 years. Therefore, it is called as maturity onset diabetes mellitus. The defect of lack of insulin action is not production of insulin. So here what happens is there is decrease in the number of target cell insulin receptors. Therefore, there is a lack of sensitivity to the insulin, and so blood often contains normal levels of insulin, but blood glucose level can be seen increased. Type 2 diabetes is seen in obese people because of improper diet and improper maintenance of the lifestyle. Gestational diabetes. So this type of diabetes, normally when a woman is pregnant, in her late pregnancy, there might be observance of impaired glucose tolerance, which is called as gestational diabetes. Mostly subject reverts back to normal glucose tolerance after delivery. So in this what happens is, after the delivery, the blood sugar level of that women will be seen in the normal range, but they have a high risk of getting diabetes in future. So this picture shows healthy type 1 and type 2 individuals blood circulation in which the glucose and insulin, how it is maintained. So now you see in the first one, in the healthy individual, the pancreas is able to secrete insulin. The cells have got receptors, and therefore there is action of insulin, and therefore glucose is being eliminated. Whereas in type 2, the pancreas is having a failure to produce insulin. Therefore what happens is glucose levels will be seen increased. In type 2, insulin is produced, it is there in the normal range, but it is sensitive to the insulin receptors. Therefore glucose level can be seen increased. So there are some signs and symptoms of diabetes mellitus. So when an individual is affected with diabetes, some of the most common symptoms can be occurring, such as increased thirst, frequent urination, unexpected weight loss, blurred vision, numbness and tingling, and delayed wound healing. So let's go in detail about the signs and symptoms of diabetes mellitus. Hyperglycemia. Insulin hormone reduces the blood glucose level in diabetes mellitus. What happens is there is increase in glucose level because there is either absolute or relative insulin deficiency. So, glycosuria. Normally the urine does not contain glucose, but in diabetic people glycosuria can occur because the normal threshold level is 180 mg per deciliter. When it exceeds the threshold level, the blood glucose can be seen being excreted out in the urine. Therefore, the patient can have glycosuria. Polyuria, it is accompanied by water due to osmotic effect of glucose. So, the person passes more urine. Dehydration and electrolyte depletion. Since the person is excreting a lot amount of urine which excretes out electrolytes such as sodium and potassium, the person tend to have dehydration. So, to compensate it, thirst center is activated and the person drinks more water. Muscle wasting. Normally carbohydrates produce energy and the other nutrients are there for the body maintenance. Since in diabetic people, muscle wasting. Since carbohydrates do not provide energy, the body proteins are broken down to give energy, leading to muscle wasting. So, normally carbohydrates are the source of energy, whereas the proteins and the other nutrients help in the growth and maintenance. In diabetic people, the carbohydrate food amount is reduced, therefore, the protein is broken down for the energy, leading to muscle wasting. Loss of body weight. Loss of body weight and muscle wasting leads to loss of body weight. Polyphagia. Since there is loss of weight, to compensate the muscle wasting, diabetics eat more. Delayed wound healing. In diabetes, since carbohydrates do not give energy, the body gets energy from proteins and proteins not available for growth, maintenance and tissue repair. So, normally carbohydrate does the energy giving part and proteins help in maintaining the body growth. Here in diabetic people there is no carbohydrate intake, therefore proteins are being broken down to give energy, therefore the body growth maintenance becomes slow. Therefore, the person who is having diabetes might have slow wound healing. Complications of diabetes mellitus. So, prolonged battle with diabetes mellitus can lead to certain complications which can be life threatening. Complications of diabetes mellitus. So, complications of diabetes mellitus can be broadly categorized into microvascular and macrovascular complication. So, under microvascular complications we have diabetic retinopathy, diabetic nephropathy, diabetic neuropathy. Coming under macrovascular complications, we have cardiovascular disease, peripheral vascular disease, and there are other complications such as ketoacidosis. So, coming under microvascular complications, we have diabetic retinopathy. So, here what happens is there is damage to the blood vessels in the retina of the eye, leading to vision impairment and potentially blindness. Cataract. So, increased glucose level in the body gets converted to sorbitol formation and that sorbitol gets accumulated on the lens and causes cataract. Diabetic nephropathy. Damage to the small blood vessels of the kidney leading to chronic disease and eventually kidney failure. Diabetic neuropathy. In this case, the nerves of the peripheral nerves of the feet and the legs get damaged, where there is symptoms such as numbness, tingling pain and loss of sensation. Macrovascular complications we have cardiovascular disease. So, diabetic people there is macrovascular complication, cardiovascular disease. In diabetes there is increase of heart disease, stroke and peripheral vascular diseases due to the damage of blood vessels and atherosclerosis. Peripheral vascular disease. So, since there is a peripheral nerve damage and there is a reduced blood flow to the extremities, which increases the risk of complications such as foot ulcers and gangrene. Other complications we have ketoacidosis. So, when the carbohydrate is not there to produce energy, the fatty acids produce acetyl-CoA which gets oxidized by the citric acid cycle. But when this acetyl-CoA gets increased up, the citric acid cycle is not able to use it all, therefore, it goes to the other cycle which is called as ketogenesis, which means it is the production of ketone body. So, among the three ketone bodies, we have acetoacetate and beta hydroxybutyrate. They are the strong acids, they reduce the pH causing acidosis. So, increase in their concentration in the blood causes diabetic ketoacidosis, which can be life threatening, can result in coma, even death if not treated. So, coming to the diagnosis of diabetes mellitus, blood glucose estimation. So, we can do blood as well as urine estimation. So, coming under blood glucose estimation, we have glucose oxidase method, which is one of the best method for the estimation of blood glucose. So, we can take fasting blood sugar sample, postprandial and random glucose sample. So, coming to the fasting blood sample, overnight fasting, early morning sample is being collected. So, in a normal individual, the level should be within 70 to 110 milligram per deciliter, and in diabetic, if it increases more than 126 mg per deciliter, it is said to be diabetic. And the people who come in the body in between, that is 110 to 125, are called as impaired glucose tolerant or pre-diabetic. Postprandial sample is the one after having food, after 2 hours the blood is being collected. So, the level should be within 140 mg per deciliter, which comes under the normal range. If it crosses 200 mg per deciliter, it is said to be diabetic, and the people coming under 140 to 199 mg per deciliter are said to be pre-diabetic. Random sample can be collected at any point of the day. So, the normal level, it should be within 70 to 140 mg per deciliter, and if it is above 200 mg per deciliter, it is said to be diabetic, and within 140 to 199 mg per deciliter, it is pre-diabetic condition. So, oral glucose tolerance test. This is a test where a person is given glucose load, and fasting as well as at a different period of time, the blood as well as urine sample is collected, and the tolerance of the person to the glucose given is been estimated. So, this test measures the blood glucose level over the past 2 hours after drinking a glucose rich solution, and if the person's level goes above 200 mg per deciliter, it confirms that the person is diabetic. So, hemoglobin A1C, or you can call it as glycated hemoglobin or HbA1c. So, it is produced when this glucose in the blood sticks to the hemoglobin. So, glycated hemoglobin is a very good marker for diabetic estimation, because it reflects the average blood glucose level over the past 2 to 3 months. So, if a person's levels above 6.5%, then person is said to be diabetic. So, the normal level is 5.7%, and the range comes within 5.7 to 6.4 indicates pre-diabetic. Estimation of glucose in urine. So, in a normal individual, the glucose is not been excreted out in the urine. When it reaches the threshold level, that is 180 mg per deciliter, then only the blood glucose level can be seen in the urine, and that time it is called as glycosuria. So, glycosuria occurs, as I said, when the level goes above 180 mg per deciliter. So, urine is tested for the presence of glucose. Either we can do Benedict's test or we can use this dipstick method. So, presence of glucose in urine is a possible indicator of diabetes mellitus. So, talking about Benedict's test, it is a qualitative test used to detect presence of reducing sugar such as glucose and fructose. So, when we treat a Benedict's reagent with a urine sample, on heating it will change the color. So, change in the color indicates the presence of glucose, but Benedict's test answers all the sugars and reducing substances in urine, which can give a false positive test for diabetes. Dipstick test, this is one of the well known tests which is carried out in the laboratories. A urine dipstick is a diagnostic tool used for analyzing urine. So, this dipstick strip consists of it's a plastic strip which consists of reagent pads. There are different reagent pads such as glucose, bilirubin, ketone bodies, etc. So, when you dip this in the urine sample, the pads change their color depending upon the presence of glucose or any other parameter which is present. So, it is one of the easy method used to estimate glucose in urine. So, management of diabetes mellitus. Proper diet, exercise, drugs and insulin are the option for the management of diabetes mellitus. So, first one is the insulin injection. So, insulin is a drug of choice for type 1 diabetic people because they cannot produce insulin. So, they are totally dependent on insulin. Type 2 diabetic people, only when the oral drugs do not work, that time they have to take additional insulin injections. Diet and exercise. Almost 50% of the type 2 diabetic people can control their sugar level by proper diet and exercise. A diabetic patient is advised to take low diet in carbohydrates and fat and should take rich protein and fibers. Refined sugar and saturated fat should be avoided. Oral hypoglycemic drugs. So, oral hypoglycemic drugs are a group of drugs which help reduce the amount of sugar present in the blood, but these are not insulin. They can only stimulate the pancreas to produce insulin. So, oral hypoglycemic drugs are drugs of choice for type 2 diabetic people. Monitoring of the blood sugar level is very much important. So, everyday monitoring is required. So, glucometer, it is a point of care testing device which is used to check rapid glucose level. This measures blood glucose level by analyzing a small drop of blood obtained from fingertip or alternative site. So, this glucometer helps the patient to monitor their blood glucose level at home itself. It is not required that you have to go to the hospital for the blood checkup every day. So, this device helps to monitor and check your blood sugar level every day. So, regular monitoring can help individual manage their diabetes by adjusting diet, exercise and medication to maintain their glucose with a healthy range. Diabetes mellitus is a metabolic disease caused either due to insulin deficiency or failure in insulin action or both. So, either there is improper production of insulin or there is production of insulin but lack of action or both. So, diabetes is being classified into two types. We have type 1 and type 2. Type 1 is insulin dependent diabetes mellitus and type 2 is non-insulin dependent diabetes mellitus. Some of the most common signs and symptoms of diabetes are polyuria, polydipsia, polyphagia, delayed wound healing and etc. Clinical complications associated to long-term diabetes are neuropathy, retinopathy, nephropathy, cardiovascular disease, peripheral vascular disease, ketoacidosis and so on. So, diagnosis of diabetes can be done either by blood or an urine estimation. Proper diet and exercise can help a lot in managing the diabetes along with insulin injection and oral hypoglycemic drugs. References Vasudeva textbook and Satyanarayana. Thank you.